FLOLOG PHARM is an AI-powered telepharmacy platform right here in Nigeria. We're bridging the access to pharmacy care. The access to pharmacy care is broken here in Nigeria. From cultural experience, we see that out of every 10 patients, 7 of them will first go to a pharmacist first before going to the hospital. According to the World Health Organization standards, the pharmacist to patient ratio here in Nigeria is really poor. We have a comparative 1 pharmacist to 20,000 patients, as opposed to the standard which is recommended of 1 pharmacist to 2,000 patients. We got exposed to community practice here in Nigeria. We could see from a first-hand perspective the bridge in the access, and also we could also see the increase in the rate of chronic diseases here, which ultimately we could see it live while we're practicing, that the need for medications use and also the follow-up with the patients using medications on a daily basis has increased.
Mom care is a package that helps to enhance primary health care system, local places where the poor and even the average cannot access better health care. So we come in to enhance what is already there, but in a better way. So we bring digital system into it. And in that case, we also have outcomes, and the outcomes are always positive.
Ina gode wa Allah kuma ina gode wannan kungiya saboda dalilin ta ne muka samu wannan taimako. Ana yajin aiki, sun taimaka mana sosai, sun mana aiki ba tare da mun biya ko sisi ba. Mun gode sosai. Baby tana cikin halin lafiya, haka uwarta ma tana cikin lafiya kalau. Mun gode.
The government has been doing a lot in trying to improve, healthcare delivery and social services basically across all sectors. And what I see is these products that are actually showcased will play a significant role in actually enhancing that process. It's something that I believe the government is really excited about, and I believe if we are able to succeed in pushing this pilot project through, then I believe scaling this up will not be a difficult thing because of the promises they hold.
We'll have safe motherhood, we'll have safe delivery, we'll have safe and healthy babies, we'll have a healthy environment, and we'll promote mother and child care so as the husbands, the relatives, the brothers, the sisters, they can smile again and have more confidence in our health system all over the world, especially in Nigeria as a whole.